It's National Nurses Week, so in this week's Mental Health and Me, we're focusing on nurses and the unique mental health challenges that they have faced throughout the pandemic. And joining us now is Sarah Ryder, a psychiatric nurse practitioner at UC Health Center for Dependency, Addiction, and Rehabilitation. So Sarah, thank you for being with us. Is there any way, in just a few words, you can describe what this last year has been like for you and your colleagues?
Well, first of all, thank you so much for having me today. I really appreciate it. I would say the words that come to mind over this past year: uncertainty, creativity, teamwork, a little bit of humor thrown in. The uncertainty at the beginning of the pandemic was really around, for me and my colleagues, working in a communal setting. I work in a substance use treatment facility where a good portion of the treatment involves the community being together. And so we had to be creative in providing care to our patients and connecting with our patients in ways that we could still implement infection prevention. So doing things like going outdoors more for appointments. We have a wheeling library that we can bring to patients' rooms. Patients sign up for A meetings that are worldwide, so they kind of do a tour. And then really just the teamwork, everyone jumping in and helping each other, which we already are in a collaborative field, but I think the pandemic has really deepened those relationships.
So in some respects, that part is good to hear. But we know nurses are really the ultimate caregivers. I mean, that's what you do. And there's so much compassion with nurses. So how are they taking care of themselves?
Well, this is a great question. And it's something like a lot of components of the pandemic. We've seen that self-care, mental health issues in nursing have been present for a long time, and we're just seeing it sort of rise to the surface in the same way that we've seen health disparities and economic disparities this past year. And I think, the best answer to that is to put it back on the system. How is the system taking care of us? Often when people are in crisis and it's a chaotic time, self-care can be a word where it sounds like another task to check off our list. And then these feelings of guilt arise, like, oh, I'm not doing this, and I'm also not taking care of myself. And so the way that the American Nurses Association is looking at this is we really need to make system level changes and really start thinking about this more as less as crisis treatment and more as prevention.
That would make sense. When we talk about the isolation, we've all suffered from the effects of isolation. And then our caregivers are the ones that are knowing how much we're all wanting to be together, especially if somebody's ill. But it impacts all of your mental health, that isolation piece.
Yes. So we have a saying in recovery that the opposite of addiction is connection. And I think that's true for recovery in many different ways: recovery from substance use, recovery from depression, recovery from stress. And it has been tricky because our old sort of go-to methods of connection have not been there. And so that's, again, where this creativity comes in, and why we see Zoom dinners with friends and things like that. So that definitely has been challenging. And I think that for a lot of healthcare workers, it's been, the stress of being at work and then coming home and not having the normal go-to stress relievers that we normally would have.
Yeah, no kidding. Well, we thank you. We don't thank you enough, but we say thank you to all of our healthcare workers, and especially in this Nurses Week. So, Sarah, thank you for shining a light, and especially in your work with addiction and recovery. I know that's a long-term thing, especially now. So thank you so much.
You're welcome. Thank you for having me.